We will discuss typhoid fever. So, what is typhoid fever? Typhoid fever is a fever that has step pattern and caused by Salmonella typhi and in some cases Salmonella paratyphi. The mechanism of its infection is it enters the body through the fecal oral route. When it enters the body through the fecal oral route, then the Salmonella typhi breaches the intestinal mucosa and it enters the Peyer's patches. In the Peyer's patches, it replicates and it may sometimes cause ulceration of the Peyer's patches. It also enters the lymph nodes and replicates there and can also enter the spleen, and here it causes splenomegaly. It can also spread to the other organs known as bacteremia through the blood, and the organs that are affected by Salmonella typhi are lungs, gallbladder, kidneys and central nervous system. What are the signs and symptoms that you will see in these patients? Initially, within 7 days, the patient presents with headache, malaise, fever. What type of fever? Fever is step ladder pattern fever, that is, it increases in intensity with time. The patient also has features of cough, symptoms of abdominal pain, sore throat, and also has in some patients there is constipation, while in some patients there is diarrhea, and diarrhea is like peas in the water. On examination, you will observe that there is splenomegaly, abdominal distension due to constipation, there is tenderness in the abdomen, heart rate is slower, that is known as relative bradycardia, meningismus, that is signs of meningeal irritability like neck stiffness, and you can also find Carnegie and Budinsky signs. And also there are rose spots. What are rose spots? Rose spots are small spots or papules that are present on the trunk, and these blanch when you apply pressure. When you do investigations, you will first perform CBC. In CBC, you will see that there is leukopenia, anemia, and decreased platelet count. So, you can see that there is pancytopenia. The best test for diagnosis of enteric fever is blood culture, and it is 80% efficient in diagnosing the enteric fever in first week. The differentials for enteric fever are TB, brucellosis, lymphoma, hepatitis, malaria, and amoebiasis. Malaria and amoebiasis, these both are especially differentials in travelers. What are the complications that can occur with this enteric fever? The life-threatening complications are intestinal hemorrhage and intestinal perforation. Intestinal hemorrhage and intestinal perforation when occur, then the patient presents with tachycardia instead of bradycardia, and also there is tender and tense abdomen. And you know that there is normally there is leukopenia in typhoid, but here there is leukocytosis, that is WBC count becomes higher. There are some other complications that are less common, and the important complications are these: intestinal hemorrhage and perforation. Furthermore, it can also cause endocarditis, septic arthritis, and osteomyelitis. What is the treatment for Salmonella typhi infection? The treatment for Salmonella typhi infection is ceftriaxone injections 2 gram twice a day for 2 weeks, or azithromycin tablet given as 1 gram on first day and for 6 days 500 milligram once a day. So hope you will like this video on enteric fever. Kindly subscribe and share this video.